Hey guys, after looking at our schedule and kind of breaking down the next couple of weeks, because we only have 9 e-learning days, distance learning days left, and I want to try and get to as much as we can. So we're going to skip over chapter 9. A lot of it was some academic knowledge, and most of it. Um, Nearly all of it was stuff that you would go over in medical terminology and anatomy, and even some into health science. So we're going to skip to chapter 10 so we can get into some diagnostic stuff. Okay, so we're going to look at the 13 vocab words. Body alignment. Body alignment is positioning of the body without any twists or making the spine crooked. Okay, so lying on your side, kind of throwing one leg over the top or kind of twisting your body, that would not be good body alignment. Diagnostic, okay? We use the word diagnostic a lot, and um, I think we all probably have a pretty good grasp on what diagnostic means, but it's basically pertaining to identifying what disease or what syndrome or what the problem is, why you're having the symptoms that you are. Okay, so we talk about diagnostic testing. Doctors um, use diagnostics all the time to figure out what's going on, to give us a diagnosis of what the problem is. Discretion. Okay, discretion is one of my favorite words because discretion is so, so important in healthcare. And it is basically knowing when you should keep your mouth shut, knowing when there are things that shouldn't be discussed. Okay. Um, Certainly, if we had a big test and a few of you, let's say maybe Macy and Ella, just totally bombed it, just completely failed. And I got up in front of the class and said, well, goodness, everybody did great except for Macy and Ella. They just completely bombed it. Okay. That's not showing much discretion. I shouldn't ever broadcast test scores or how someone in particular did on the test. Okay. So that's using discretion. The ability to know when to keep sensitive information private. Um, all healthcare information, we should use discretion. We should not be sharing any of that information. Okay. First aid. First aid is something that when I see the word first aid, I get kind of sad, honestly, because I was so looking forward to my health science class as they were learning first aid this semester. In fact, we were supposed to do it just, I think, last week. We were scheduled to have first aid class and get the kids certified in first aid. But first aid is any of that care that you can provide, that you can do before um, more formal medical care gets there. So that care that's provided, before getting someone to the hospital. Okay, maybe in my case, it's that care that I provide before the ambulance crew gets there, or before I tell a kid that his parents need to take him to the emergency room. So it's emergency treatment given before regular medical services can be obtained. So sometimes it's CPR, sometimes it's stopping the bleeding, sometimes it's calming a patient down and just getting them to slowly breathe through and regain control of their breathing. Okay. Gross pay. Okay. This is when you some of you are already working, but when you first get your first big paycheck and you're in your first big job and you get your paycheck and you look at the statement that's with it, the I can't think of what it's called, but the pay stub that's got, everything outlined. This shows your deductions and maybe your insurance coming out of there and maybe a health savings plan coming out, all those things coming out. And you look at the total gross pay and you're like, holy smokes, I am making crazy money. And then you look at all those deductions and you're not bringing home much. Okay, your net pay is not much, but your gross pay is that initial amount, how much you make in a pay period before anything's taken out, before any taxes are taken out, before any insurance is taken out, life insurance is taken out, any of those things are taken out after you get that amount for the gross pay. Incompetence. Okay, incompetence is another big word, but it's that lack of ability um, or qualifications to perform your job tasks. Okay, if I came in and I did not know how to tape an ankle, I would be incompetent as an athletic trainer. Okay, if I didn't know how to evaluate a knee injury, that's incompetence as an athletic trainer. So it can vary from job to job based on the tasks that you have to do. Okay. I've had jobs working with orthopedics, and the first, few times I worked with them, I was pretty incompetent in some of the things they wanted me to do. But then they would show me, they would teach me different ways to do things, and I became competent in those things. Okay. So it varies from job to job, varies from setting to setting, that what those tasks are and what those skills are. Integrity. I like integrity too. That's another big word for me. Um, and I think integrity says it all. Okay. Um, we get into ethics a whole lot in health science one, and it's a lot of fun because we really get to see the integrity level of other people, the other students in the class. And so it's a lot of fun to discuss all that. Um, I wish that we were in the classroom so we could discuss some integrity stuff, but it's kind of difficult right now. So you'll have to hold off until we get into health science to get into some of those discussions. But basically, integrity is doing what you think is right, no matter who's watching. Okay. So, if I um, if I treat someone one way on the football field because there's a bunch of people watching me, evaluate that ankle. But then I do, if it's just me and them on the practice field, and I do hardly any of the same testing, that's not showing integrity. Okay. So it's doing, what you feel is right, doing the right thing, no matter who's watching. So adherence to ethical principles and professional standards, always, all the time, no matter what, no matter who's watching, no matter what's happening, that's integrity. Invasive procedure. That is a procedure in which um, there has to be an incision or some instruments inserted into the body. Net pay. I alluded to net pay earlier. It's the kind of the opposite of gross pay, but it's that pay afterwards, after the deductions are taken out, after taxes are out, after insurance is out, all those things are pulled out. That's what you actually take home is your net pay. So it's that amount of money received in a pay period after all deductions have been taken out. Non-invasive procedure. So if an invasive procedure is um, having an incision, inserting um, instruments into the body, non-invasive is not doing that. You do not have an incision and you do not have to put instruments into the body, those kinds of procedures. So an MRI would be a non-invasive procedure. Now, an MRI, which we call it an MRA, um, is an invasive procedure, okay? Because in an MRA, they inject the joint, they inject dye into the joint, and then they take MRI images of it, okay? So that makes it invasive. So it depends on the type. but it is a test or treatment that does not require incisions to the skin or the insertion of instruments into the body. Radiographer are those healthcare professionals who create medical images, or sometimes they treat diseases by using radiation um, through an object. Okay, so the people that take the x ray at the hospital or take the MRI, radiographer. Sonographer, okay, they are creating medical images or treating diseases through the use of sound waves. So, some examples of that we're going to get into later might be the tech that uses the ultrasound waves or the sound waves to see images of a baby while the mother is pregnant. Okay, that would be an example. Vital signs. Vital signs are those measurements that tell us a whole lot about um, someone's health status. Okay, so those things include temperature, pulse, respiration, and blood pressure. We're not going to get into the fine details of vital signs as far as the normal ranges or how to take the vital signs because we spend a lot of time in that in health science 1 and 2. And so you'll get, if you stick with me, you'll get lots and lots of practice in that, and that you'll be a pro at the vital signs. Okay, and that's the last one for today that we're going to go over. Um, I'm going to have you do a little practice activity, and then we will continue with some more tomorrow. This chapter is a lot of vocab words. Okay, we've got the 13 vocab words at the beginning that are kind of the key vocab words, and then I pulled out vocab words after that. That's how we're going to handle covering this chapter for the most part. There's a couple other things that I want to talk about, some stuff with recognizing strokes and things like that. But for the most part, it's going to be vocab. Okay, we'll get through it pretty quickly, and then we'll move on to the next chapter. Of course, like always, if you have any questions, any concerns, any issues, anything you need to talk to me about, please reach out. Um, I miss you guys, and any interaction that I can get with you guys, anything I can do to help, I really want to do it. Okay, so please just let me know. Talk to you soon.